In this program, we will demonstrate how efficiently and safely a well-prepared response team can perform their role when there is a hazardous materials incident in their community. This program is designed to demonstrate general procedures and techniques for patient management. More detailed information is provided in the guidance document entitled Emergency Medical Services, a planning guide for managing contaminated patients from the Agency for Toxic Substances and Disease Registry.
Radio to Unit 21.
Unit 21, 3rd and Winkler.
Unit 21 in the 5th District, make Star Enterprises.
At Star Enterprises, 4th and Carpenter, number 4 and Carpenter. You have an injured person, code 3, run 300410 3410. Call received 0935. Use the loading dock entrance.
Unit 21, okay on Star Enterprises, 4th and Carpenter loading dock, 4106.
Unit 21, be advised you have a 25-year-old male with possible leg injuries. Patients trapped under a leaking chemical drum. Be advised hazardous materials may be involved. Fire department is en route.
Unit 21, okay on fire department responding, and we're okay on hazardous materials may be involved. Do you have any information on those hazardous materials?
Fire department will provide, and we'll relay that information to you as we get it.
10-4 radio.
Emergency medical response to hazardous materials incidents presents special challenges to the emergency medical services system in any community. Chemical contamination can pose a threat of exposure and adverse health effects to not only the patient, but also to subsequent healthcare providers and the public. Objectives for patient care are terminating patient's exposure to the chemical, preventing further injury to the patient, and providing prompt and effective patient treatment. Other health and safety concerns are preventing contamination of other persons or areas and preventing injury or exposure to responders. Within a community, the response to a hazardous materials incident should be a coordinated effort by the fire department, the emergency medical services system, the health department, police department, hospitals, and other community responders. EMS must work together within the local response community in the development of a hazardous materials response system. Title III of the Superfund Amendment and Reauthorization Act 1986, or SARA Title III, mandated that a mechanism be established so that local communities could prepare contingency plans to deal with these types of incidents. To facilitate this planning, local emergency planning committees, or LEPCs, were formed. Participation by EMS, health departments, and hospitals, among others, in the planning process is required by SARA Title III, which is also known as the Emergency Planning and Community Right to Know Act. In emergency response, safety is always a priority. To be part of the solution and not part of the problem, responders must consider their own safety, the patient's safety, and the community's safety during each phase of an emergency medical response. In this program, we'll take a close look at each phase: responding to the call, arriving at the scene, decontamination and medical management of the patient, and transporting the patient. When responding to a call, it's always a good idea for response teams to be alert to the possibility that hazardous materials might be involved. Hazardous materials incidents could involve an overturned tanker truck or even a hardware store, grain storage facility, or manufacturing facility. As soon as the response team is aware that hazardous materials are involved, they should immediately begin gathering as much information as possible, even before they get to the incident site. Information about the chemical involved should include the chemical name of the substance, which should be spelled out, and commonly used names and synonyms. The physical state of the chemical, that is, whether it's a solid, a liquid, or a gas, and its flammable properties. To determine decontamination and treatment options, information should be gathered to answer such questions as, are the chemical vapors heavier than air, or will chemical liquids float or sink in water? Is the chemical soluble in water? And does the chemical react with common substances, such as air or water? Other information that responders should gather is specific to the incident, such as possible routes of entry into the human body. That is, whether it was inhaled, absorbed through the skin, or ingested. The quantity involved, length of exposure to the patient, signs and symptoms, number of patients, and if the chemical release is still occurring. Sources for this information include poison control centers, product labeling and markings, material safety data sheets, the emergency response hotline of the Agency for Toxic Substances and Disease Registry, the Chemical Transportation Emergency Response Center of the Chemical Manufacturers Association, known as Chemtrack, the occupational health staff at some facilities, and the local incident commander. To protect responders and facilitate their actions, information should also be gathered on what personal protective equipment, or PPE, is necessary, the possible adverse health effects of exposure, decontamination procedures, and the treatment or antidote therapy which may be required. In the opening scene, we saw a call come in involving an injury with possible patient contamination. Consider how the efforts of all responders are coordinated to meet the challenges of this hazardous materials incident. Also, consider what you would do if you were the first responder on scene in a similar situation.
Radio to Unit 21. Unit 21, go ahead.
Unit 21, fire indicates chemical name is perchloroethylene. Copy. P. Paul, E. Edward, R. Robert, C. Charlie, H. Henry, L. Lincoln, O. Ocean, R. Robert, O. Ocean, E. Edward, T. Tom, H. Henry, Y. Young, L. Lincoln, E. Edward, and Nora, E. Edward.
Unit 21 is okay on perchloroethylene.
Unit 21, stand by to copy material safety data.
21 prepared to copy, go ahead.
Synonyms are tetrachloroethylene, PERC, and PCE.
Substance can be inhaled, absorbed, ingested, and also desensitized sense of smell.
Symptoms of exposure: nausea, vomiting, irritation of the skin, and mucous membranes. Avoid contact with chemical vapor. Fire department hazmat units on the scene, command posts, entrance to parking lot. Report to the incident commander there.
Unit 21, okay on all information.
While the EMS team is en route to the incident site, this community's response system is already underway. With pre-planning and an effective system, the efforts of all first responders can be coordinated. Let's take a look at the system in action.
52 to radio. I'm at 4th and Carpenter, Star Enterprises. Got a 4-story brick warehouse. Looks like we've got an incident on the loading dock.
What do you got, Major? On the loading dock.
Looks like we got perchloroethylene involved there, Steve. Okay. Let's get some guys suited up and level B and get them in there. Get that victim out of there.
One victim is all we got?
One
guy
victim
down?
is all, right.
Okay. All right, guys, we're going to go in level
52 to radio. This will be a level 1 incident. 52 will be...
The incident commander directs the efforts of all local response personnel, including police, firefighters, EMTs, and special force teams, and on-site security personnel. Often, the incident commander is the senior fire department officer on the scene. The individual in this role is designated in the local contingency plan prepared by your LEPC. The incident commander or his staff identifies control zones designed to isolate the contaminated area. No one is allowed to cross into a control zone unless they're properly protected and have a specific purpose for entering. If the hazardous material is airborne, determining a safe approach corridor for emergency personnel becomes more complicated. Variables such as wind direction and speed, as well as the terrain, must be considered. Many communities have specialized teams that can respond to these emergencies, such as a hazardous materials response team. These teams are made up of firefighters, EMTs, and chemical and rescue specialists. They've been specially trained to deal with incidents of this type and possess a range of skills.
Hey, Chief. I'm Sharon with EMS. This is Chris. What do you got?
Well, Sharon, looks like we got a dock incident up here. One victim looks to be a male. I've got a hazmat team going in now for a observation, and we're going to check him out up at that point, and we'll let you know as soon as we do a little more definite on it.
Okay.
Matter of fact, I'm going to call him now, so you're welcome to stand here if you'd like.
Okay.
Command to hazmat 15. Can you verify that chemical is being perchloroethylene? Command to hazmat 15. How about the condition of the patient? Give me an update on that.
Well, the victim has a open fracture of the right shin bone and also a possible fracture of the left leg. And the product is in the wounded front.
Man is okay on the fractured hip there. Is that the right leg? Command is okay. So what we got here, we got a person that's been involved in a perchloroethylene, which is a hazardous material spill. He's got fractures of one leg we're aware of, and possibly the second leg. What we'll have to do, the team will put him on the backboard, bring him through decon. After we got him through decon, then we'll hand him off to you all for treatment, transportation, or whatever.
Okay.
We'll set the gurney up right over here at the end of what we're going to designate as a warm zone, and you can take him from that point.
Okay.
All right?
Sounds good. We'll wait for you over here then.
We'll be at command center if you need us.
Okay, thanks.
Thank you.
A primary assessment of the patient's health is undertaken, giving priority to the ABCs, that is, airway, breathing, and circulation. As quickly as it's appropriate to do so, administer oxygen if needed, and check for excessive bleeding. In this case, immediate priorities will include immobilizing the cervical spine and stabilizing fractures.
Command to hazmat 15. When you transport that victim out, leave one personnel behind for mitigation.
Before making decisions about decontamination, the following should be considered: the patient's immediate physical condition, the possibilities of contaminating responders, and the effect of weather conditions for safe decontamination in the field.
Get him out of here. Okay. Okay. You ready?
Take out now,
Okay, we'll have somebody back here with you in just a minute, okay? Let's get this guy out of here.
up on 3. 1, 2, 3.
Okay, let's get it out of here.
Stopping the exposure to the contaminant can best be accomplished by removing the patient from the exposure area to the decon area and then removing contaminants from the patient. The facilities and equipment used for decon will vary widely from community to community. However, a few basic needs must be met. Decon should be set up in a clean area where there's no contamination. The area must be a safe distance from the exposure area in case the scope of the incident increases. Yet, it should be close enough so rescuers will only have to move the patient a minimal distance. The decon area should be located upwind if possible and a safe distance from any runoff. The decon area for injured persons should be ready to handle non-ambulatory patients. Trained and equipped workers should provide decontamination in a manner that protects both workers and patients.
You go over and get decon. We'll take him from here.
Okay.
To begin decontamination, cut away or remove all clothing. Remove jewelry and contact lenses, and remove any obvious contamination. Rescue workers must be careful not to transfer contaminants to the patient, to decon workers, or to clean equipment. The order of the decontamination should be open wounds first. After decontamination of any breaches of the skin barrier, it's important that these sites be protected from recontamination with Rinse-Aid. Once the wound has been addressed, decontamination should proceed in an orderly manner, beginning with the head and proceeding down the body. Special attention should be paid to the eyes and mucous membranes. Soap should not be used to clean these sensitive areas. When cleaning the patient should be sponged with a mild soap solution, followed by a gentle rinse. Avoid abrasion to the skin, since this could increase the absorption rate of the
Roll
chemical.
them up on this side. Take them off some more. I'll go get another seat collar. We'll get 2 more blocks. Almost finished, buddy.
Provisions for the collection and disposal of the rinsate should be made, as well as provisions for keeping the patient out of the rinsate.
Almost finished, buddy. I'll get these old strips off. Okay, on the count of 3. 1, 2, 3. Watch your footing. Just transfer right around these presses. Okay, it's all yours.
Once decontaminated, the patient can be handed over to the EMS team for stabilization and transportation to the hospital.
Just hurt around your head at all? Let me know you're here. Talk to me a little bit, okay? You know what day this is? Open your eyes. There you go.
As always, a thorough secondary patient survey should be conducted. With this patient, an assessment of the circulatory and neurologic status distal to fracture sites is an essential component of the secondary survey.
Mike, can you feel this?
As the survey is completed, patient's injuries are immobilized to prevent further injury, and the patient is prepared for transportation.
Let's go.
Okay. Gary, you're coming with us, right?
Yeah, let's go.
No obvious head trauma. His vital signs are pulse 110, BP 100/64, and his respiration is 12 and shallow. I'm putting hazmat on. He's going to give you additional information.
10-4.
Montgomery General, are you ready to copy?
Go ahead, Unit 21.
We're dealing with perchloroethylene. Perchloroethylene. Patient's eyes appear irritated by vapors, but it doesn't look like he's had any direct contact with the liquid in his eyes. The chemical wasn't ingested, but he has been exposed from the waist down. The exposed skin shows mild sign of irritation. Patient has a tib fib fracture in the left leg and a compound fracture in the right tib fib. There's a minor amount of bleeding at the wound site. The extremity is pale and cool. Distal pulse in the right leg is barely palpable.
Unit 21, does the patient need additional decon?
I suggest you continue washing the exposed area. We were as thorough as we could be under field conditions. We removed enough so that the patient doesn't pose a secondary respiratory threat.
Okay, we're getting set up. Come to the emergency room entrance marked hazmat. It's at the rear of the building next to the loading dock. Someone will be there to direct you in. What is your ETA, Unit 21?
About 15 minutes.
All right, the doctor is here. He'll give you further instructions.
10-4.
This is Dr. Schreier. I'll meet you at the hazmat entrance. Hang an IV with normal saline and run it wide open. Monitor vitals every 5 to 10 minutes and check pulses in the extremities. Put him on a cardiac monitor and make sure both legs are immobilized. Let me know when you're about 2 minutes from the hospital.
10-4.
Reassess the patient's condition frequently, since exposure to many hazardous materials may produce delayed effects. Prophylactic invasive procedures, such as IVs or intubations, should only be done after the patient is decontaminated. These procedures can provide a direct route for introduction of the contaminant into the patient. Contaminated patients should enter the hospital through an area that will not put other patients at risk, and at the same time will allow for further decontamination.
BP's 102/7.
This is ready.
Got the monitor in the IV. We're out of here.
He was slightly hypotensive at the scene, but he never lost consciousness. His vitals are essentially unchanged and stable.
EMS providers should brief the hospital emergency department staff and be available to answer questions. Once the patient is handed over to hospital personnel, the ambulance and any equipment that came in contact with the patient must be decontaminated or properly disposed of. All individuals who may have come into contact with the substance should be decontaminated. EMS personnel should shower before putting on clean clothes and returning to service. We've seen how important it is for a community to have an integrated system for managing chemical casualties. Having a system in place before the chemical incident occurs is essential in assuring effective patient care. Medical personnel are trained to treat patients who are injured. When a chemical contaminant is involved, medical personnel must also pay attention to their own safety. First responders are accustomed to taking care of a patient's physical problems immediately because that's what they've been trained to do. Often, this is done with disregard for their own safety. While rescue of the patient is important, it should only be attempted after it is certain that it can be done safely. Patient care should not be delayed when there's only minimal risk of contamination. However, assessing the risk is often a judgment call and must be made by someone with appropriate training and experience. Only individuals with proper training in the use of personal protective equipment and rescue techniques should perform the rescue. We'd like to close this program with a selected bibliography on subjects related to the management of chemically contaminated patients in the field. We hope that these resources are helpful and that this program has brought you and your community one step closer to a system of preparedness that will be invaluable when you're faced with community challenges such as this one. In this program, we will demonstrate how efficiently and safely a well-prepared emergency department can perform their role when there's a hazardous materials incident in their community. This program is designed to demonstrate general procedures and techniques for patient management. More detailed information is provided in the guidance document entitled Hospital Emergency Departments, a planning guide for managing contaminated patients from the Agency for Toxic Substances and Disease Registry.
Montgomery General, this is Unit 21.
Go ahead, Unit 21.
We're en route with a chemically contaminated patient. Please advise when you're ready to copy.
Go ahead, Unit 21.
Patient has fractures in both legs. The right leg is a compound fracture. He's conscious, responding to verbal commands, but he is disoriented. He's been immobilized on a spine board with a cervical collar. No obvious head trauma. His vital signs are pulse 110, BP 100/64, and his respiration is 12 and shallow. I'm putting hazmat on. He's going to give you additional information.
10-4.
Montgomery General, are you ready to copy?
Go ahead, Unit 21.
We're dealing with perchloroethylene, P-E-R-C-H-L-O-R-O-E-T-H-Y-L-E-N-E. The patient's eyes appear irritated by vapors, but it doesn't look like he's had any direct contact with the liquid in his eyes. The chemical wasn't ingested, but he has been exposed from the waist down. The exposed skin shows mild sign of irritation. The patient has a tib fib fracture in the left leg and a compound fracture in the right tib fib. There's a minor amount of bleeding at the wound site. The extremity is pale and cool. Distal pulse in the right leg is barely palpable.
Unit 21. Does the patient need additional decon?
I suggest you continue washing the exposed area. We were as thorough as we could be under field conditions. We removed enough so that the patient doesn't pose a secondary respiratory threat.
Okay, we're getting set up. Come to the emergency room entrance marked hazmat. It's at the rear of the building next to the loading dock. Someone will be there to direct you in. What is your ETA, Unit 21?
About 15 minutes.
All right, the doctor is here. He'll give you further instructions.
10-4.
This is Dr. Schreier. I'll meet you at the hazmat entrance. Hang an IV with normal saline and run it wide open. Monitor vitals every 5 to 10 minutes and check pulses in the extremities. Put him on a cardiac monitor and make sure both legs are immobilized. Let me know when you're about 2 minutes from the hospital.
10-4.
The emergency medical response to hazardous materials incidents presents special challenges to the hospital emergency departments of any community. Incidents like these do not occur often, but when they do, a coordinated response between the hospital and the field is required to ensure effective and timely patient care and to prevent exposure of emergency department staff and other patients or visitors. Within a community, the response to a hazardous materials incident should be a coordinated effort by the fire department, the emergency medical services system, the health department, police department, hospitals, and other community responders. Hospital emergency departments must work together within the local response community in the development of a hazardous materials response system. Title III of the Superfund Amendment and Reauthorization Act of 1986, or SARA Title III, mandates that a mechanism be established so that local communities could prepare emergency plans to deal with these types of incidents. To facilitate this planning, local emergency planning committees, or LEPCs, were formed. Participation by hospitals, the EMS system, health departments, among others, in the planning process is required by SARA Title III, which is also known as the Emergency Planning and Community Right to Know Act. The hospital's objectives for a hazardous materials or hazmat response system are providing timely and effective care to the patient, preventing injury or overexposure to providers and the public, and preventing unnecessary contamination of equipment and critical care facilities. To accomplish these objectives, each hospital should develop a plan and a standard operating procedure for dealing with hazmat-related injuries or exposures. Typically, plans should be in place to allow gathering information on the incident and the chemical or chemicals involved, such as the route of entry into the body, duration of exposure, effects of the chemical, mobilizing the emergency department, including any key personnel identified in the plan, protecting hospital personnel from exposure, preparing and conducting decontamination of the patient, personnel, and equipment, and handling and managing the contaminated patient to prevent unnecessary contamination of hospital personnel and the facility. Safety in these operations is always a priority. Safety of the hospital staff, the community, and the patient must be considered throughout the response. The first incident in this program shows how an emergency department enters into the community's hazmat response system. In the previous scene, the emergency department nurse initiated the hospital's emergency procedures by gathering as much information as possible. The material safety data sheet will be reviewed for information on the chemical involved. Let's see how the hospital's plan is carried out.
Here's the MSDS for perchloroethylene.
Thank you.
Laura Dean, report to the nurses station. Laura Dean.
Charlotte, get poison control for me. We'll see what they've got on perchloroethylene. And while you're at it, it's not a bad idea to contact ATSDR. Then all our bases are covered.
Okay. Here you go.
Thank you. Good morning. This is Dr. Schreier at Montgomery General Hospital. We've got a patient coming in who's been exposed to perchloroethylene. I'd like any information you have on that chemical.
Well, Nancy, I'm glad you're here. A patient is coming in with bilateral tib-fib fractures. He's had direct contact with the chemical, perchloroethylene. Advise security and maintenance to put the contaminated patient plan into action. They should be here in about 15 minutes. I told the EMTs to use the hazmat entrance, but make sure security knows to have someone there to direct them in.
Okay.
Okay.
Thank you. Charlotte, I'll meet you and your team in the treatment room in about 5 minutes and let you know what I found out about perchloroethylene. Right now, I've got to check on a patient in room 3.
Okay.
What do you need, Charlotte?
We have a patient contaminated with perchloroethylene coming in, so I'm going to need your help. The hazmat team has told us to continue decon, but we don't need the respirators. We will need to keep him isolated until we're sure that the chemical no longer poses a concern. He has bilateral tib-fib fractures and an open wound in the right leg fracture.
What time do they get here?
Oh, they should be here in about 15 minutes. So go ahead and get the hazmat suite ready. Make sure it's stocked and draped, and we'll meet Dr. Schreier in the treatment room in just a few minutes.
Okay. Charlotte, I've notified security and maintenance, and they'll be ready for them.
Okay, thanks. Oh, Nancy, could you wait for the call from the EMTs? They're going to call when they're about 2 minutes away from the hospital, and we'll be in the treatment room.
Okay.
Okay, thanks.
We just got an update from Unit 21. They're about 2 minutes away, and there's been no change in the vitals.
Okay, we don't have long. Perchloroethylene. It's a chlorinated organic compound. It can be absorbed through the skin, and it can affect the liver, the kidneys, and the CNS. It irritates the mucous membranes and the skin. On contact, it'll tend to defat. It can cause nausea and has a possible narcotic effect. Cardiac arrhythmias are also possible. For decon, we'll want to do a thorough flushing of the wound, skin, and eyes. Keep him on oxygen, at least until decon is complete. I'll need x-rays of both legs as soon as we get him cleaned up. And let's get an EKG set up as soon as possible. We'll want to do a blood and a urine sample, too. On the blood, let's do a Chem 20. For the urine, send for a UA and keep some. We may need to do a tox screen later.
Here they come.
Monitoring the IV. Around here.
Got it.
So what have we got?
Well, he was slightly hypotensive at the scene, but he never lost consciousness. His vitals are essentially unchanged and stable. This is his first bag of normal saline. His level of consciousness is gradually increasing. His respiratory exposure at the site was approximately 30 minutes, and we've monitored a normal heart rhythm and no arrhythmias.
So tell me exactly what happened.
Well, the patient was unloading barrels from a truck, and one of the barrels fell out and trapped his legs, and the barrel was punctured, and the chemical leaked out onto his legs. He was initially evaluated and immobilized by me and the hazmat team. We did a pretty thorough decon. He shouldn't pose a secondary respiratory threat.
Laura, keep him on the spine board and let's get those splints over.
It's all right? You've got some bandages. I'm going to cut them off. Let me know if I hurt you. Sorry. Okay. Kind of a rough day, huh? You breathing okay and everything?
Yeah.
Okay. Remove this bandage. Like you got a nice burn there. I'm going to be working over here on the right. Bear with me. Hurting you? I'm sorry. I'm trying to be easy. I'm going to pull this bandage off. This might hurt a little bit. Now we need to remove these splints from your legs, and this is probably going to hurt. I'm sorry. Go. Okay, now the right leg. Okay, not too bad. Now we're going to get to work on cleaning you up here.
Hi, Mike.
Hi.
How we doing? All right, Mike, follow my finger. All right, now show me your teeth, Mike. Like this. Right, good. All right, Mike. Can you feel this?
Yeah.
How about this?
Feel it.
All right, how about this, Mike?
Yeah.
And this?
Yeah.
Okay. Mike, is anything else hurting besides your head and legs? All right, let's clean him up quickly and get him over to X-ray.
Mike, we're going to give you that bath, and I'm going to clean this wound on your leg. And I'm going to be irrigating it with some normal saline. You may feel some pressure or some pain, and I'll try to be real easy. Okay, here we go.
Okay.
All right, can you feel that?
I've got this little device up here that looks like a contact lens. And we're going to put it right over your eye and irrigate it.
Are you hurting real bad here in the leg? Okay. All right. I'll put this dressing on down here. Okay, now you're going to feel a little pressure here. You're doing great.
This is not easy.
This is an example of what should happen with a chemical contamination injury. The hospital had a plan, and everyone knew what to do. Hospital emergency departments must be ready to perform these procedures for any type of hazardous materials emergency. Sometimes the patient may arrive by ambulance. At other times, the patient may just drive up unannounced. Let's see how a hospital adapts to this challenge.
I wonder what that's all about. I think we're on.
Hey, somebody come out. My buddy Scott's real sick.
What happened?
Well, we're at the farm supply store down the street.
Is that where this blue powder came from?
Yeah, Scott was back in storage moving bags of copper sulfate. One split and fell on top of his head. The stuff was so thick you couldn't even see him.
What's copper sulfate used for?
It's a fungicide.
Did you say Scott?
Yeah.
Scott, can you tell me how you're feeling?
I'm sick to my stomach. I puked. My eyes and my nose are burning. My skin itches.
Okay. Bruce, go back inside. Get the oxygen and bring me some gloves, and we're going to need a few extra hands. Tell Denise and the nursing supervisor that we have a patient who's been exposed to copper sulfate.
Okay.
How long ago did this happen?
About 15, 20 minutes ago. Just as soon as Scott started complaining about his eyes, we got him into the restroom and stuck his head under the faucet. We tried to get the powder out of his eyes and flushed him until it stopped hurting. And then he started throwing up, and I didn't know what to do, so I brought him down here.
Okay, what's your name?
Mickey.
Okay, Mickey, and who do you work for?
Harrison Farm Supply.
Okay, thanks, Bruce. Here, Mickey, I want you to put these gloves on.
Okay.
Okay.
Yeah.
And then I'm going to get this mask ready.
Okay.
And I want you to put it on Scott. Okay, and I'm going to turn it on.
Okay.
Okay, and put that mask around Scott's nose and his mouth, and the strap goes in back, okay?
Okay. Like this?
The strap around back,
Okay.
And the bottom part around his
Scott.
chin.
It's gonna be okay.
That's it.
Okay.
Careful.
Okay.
Good. Okay,
Now
pull the
this.
strap tight so...
Okay.
Scott,
Okay.
can you feel that? Good. That'll help you breathe better. Okay. Now we're ready to send you around back so that we can clean this chemical off, okay? Security, Diana?
Back it up.
Okay, she'll show you around to the back dock. Okay, we just don't want the chemical to spread any further.
Okay.
And you wait for us there.
Sure.
Okay, Diana?
Okay.
Back it up now, please.
Okay. You're gonna be okay, Scott. Don't worry, everything's gonna be just fine, buddy. You're gonna be just fine.
Miss McKay, the nursing supervisor is on her way, and Denise should be here too.
Okay, then would you call poison control, and I'll call the doctor.
Okay.
Yes, could you send Dr. Vincent to emergency, please? Thank you.
Okay, what we got here?
Well, we have a walk-in hazmat patient.
We've got some
A bag of
information
copper
from poison control.
Good. Well, let's fill everybody in. A bag of copper sulfate has opened up all over the patient's head. He's covered with it. He's inhaled some of the dust and probably swallowed some. He's out back with security now, on oxygen. Only was brought in by a friend, so he'll have to be deconned too.
Poison control says the chemical is an emetic if swallowed. It can cause severe irritation of the mucous membranes, and if he hasn't vomited, it's an indication that it's being absorbed through the digestive tract. Right now, the patient is disoriented, nauseous, and he has vomited. Poison control also says we can decon with mild detergent and water.
I'll call ATSDR and find out if we need to use respirators, and if we do, what kind of filters we'll need. We may need to suit up, too. Denise, Bruce, go ahead and get the pool set up for decon in the back of the hospital.
Okay.
All right, I'm going to check on the patient.
Okay, I'll call Harrison Farm Supply and get the MSDS on copper sulfate.
By having a plan in place, the hospital is prepared to care for the patient without jeopardizing the medical staff and others who may have come into contact with a contaminated patient. Care must be taken when removing the patient's contaminated clothing. In this instance, hospital staff will give directions for clothing removal and disposal.
Jane, according to the ATSDR, we're going to need to use the respirators with the HEPA filters on them for the staff doing the decon.
Okay.
They also recommended that we use Tyvek and the polyvinyl chloride surgical gloves.
Okay. Well, the MSDS.
Scott, I'm Dr. Vincent. What happened?
A bag fell over my head. I got covered with all this blue dust. My eyes and my nose started to burn, and I puked. My skin itches something terrible.
Are you having trouble breathing?
I can't tell.
Are you experiencing shortness of breath?
No, not really.
Okay, you can take your mask off then, please. Now let me see your hands, if you would. Okay, let me check your eyes. Okay, Scott, we're going to check your head for cuts and then wash you off, and we'll need to irrigate your eyes, okay?
The key to successful management of chemically contaminated patients is to have a planned procedure in place before the patient arrives. The response to a patient who comes in by ambulance is the same as for one who comes in unannounced. The goal is a timely implementation of your plan, a plan that mobilizes hospital staff to care for the contaminated patient and at the same time protects the hospital, the staff, other patients and visitors from contamination. As you've seen, each community and each incident is unique. The methods and procedures for handling chemically contaminated patients in your hospital must be structured according to your particular facilities and the demand for this service. Some hospitals may choose to have dedicated space for decontamination. This is the case with the first hospital shown in this program. In hospitals where few emergencies of this type occur, a child's wading pool may be used for containment of decon liquids. The pool should be set up in an area away from frequent use. Also, even with an excellent plan in place, you have to be ready for surprises. As you've seen, in the case of the second hospital, the patient was successfully detained before entering the hospital. If the patient had entered the emergency area, the area would have had to be isolated and cleaned to prevent contamination of patients, visitors, and hospital staff. Let's quickly review the major steps in receiving the announced and unannounced contaminated patient in two very different hospital settings. First, gather as much information as you can. This includes type and nature of the incident, the number of victims, signs and symptoms involved, nature of the injuries, name of the chemical or chemicals involved, what decontamination was done in the field, estimated time of patient arrival at the hospital, and whether the release is ongoing. If it is ongoing and not controlled, the potential exists for the generation of more chemically contaminated patients. After the information is gathered, mobilize the hospital staff, security, and maintenance to implement your pre-planned procedures. Next, conduct decontamination in a designated area where everyone knows what to do to isolate and protect the area. Once the patient is decontaminated and in treatment, attention must be given to recovery and cleanup. All individuals who come into contact with the substance should be decontaminated. Staff should shower before putting on clean clothes. Anything which may have come into contact with a contaminated person must be cleaned or disposed of properly, including contaminated clothing, which should be laundered separately, protective clothing, medical supplies and instruments, including transport vehicles, plastic sheeting used to contain the chemical during decontamination, and materials used to protect the environment, such as the tanks or drums to contain the water used in decontaminating the patients. Usually, the decon water is sampled to determine the level of contamination. The hospital should confer with the sewer authority on the method of disposal. The procedures concerning disposal are in many of the resource books listed at the end of this program. Finally, keep in mind how the hospital's plan identified several important sources of information which help the staff determine the hazards associated with the chemical involved. The sources include the local or regional poison control center, the material safety data sheet, the manufacturer listed on the MSDS, and 24-hour hotline for ATSDR, which maintains an around-the-clock on-call team to assist you at your location or over the telephone. Remember, the key to successful management of chemically contaminated patients is to have a planned procedure in place before the patient arrives. Caring for the contaminated patient and preventing unnecessary contamination of other patients, visitors, hospital staff, and the facility must be everyone's objective.